Hi, this is Dr. Stephen Smith, and this video is on CRPS, Complex Regional Pain Syndrome, or also known as RSD, a protocol that works. I've been working with CRPS patients for quite a number of years. I don't see a lot of them because there aren't a lot of them. There's about 200,000 cases in the United States, so the average physician doesn't see a lot of them. I'm a functional medicine doctor or an integrative doctor, so I use a functional medicine approach. So what is that? Well, first let's compare it to the standard allopathic approach, which is make a diagnosis. In other words, you give it a disease a name, and you devise a treatment, typically a drug. Well, this works pretty well for things like hypertension or even diabetes. But when you start to have multifactorial chronic illnesses, it doesn't work. In fact, the disease model itself doesn't really work. What you have are multiple things that are going wrong, and you have to start fixing them. And when you start fixing function, then the symptoms just sort of drop away, and what may have been just a group of symptoms may never develop into a disease. Well, when the functional medicine approach is applied to CRPS, we find one overwhelming problem, and that's lymphedema, which is poor lymphatic drainage. As a result of that, there are elevated inflammatory cytokines, which cause the pain. We see autonomic nervous system dysfunction in the area, and we usually find low glutathione, which is the body's primary detoxifier, and methylation issues, which are genetic issues, which are underlying the poor detoxification and low glutathione. So we can go about making changes that will improve all of these situations. This is the CRPS Triangle. On the top, we show lymphedema as the main problem. Below, we show mitochondrial dysfunction. The mitochondria produce the body's energy. There's about 2,000 of them in an average liver cell. And if they're not functioning, then the body doesn't have the energy to do what it needs to do. We also find low glutathione in most of these patients. This is due to genetic issues usually, or a toxin exposure. But it sets up this whole setup. Then we have the injury that triggers this, and we have the elevated cytokines and the inability to clear toxins from the area that are the hallmarks of this condition. But we have this vicious cycle. I could have probably added more things to it, but you start with an injury, or sometimes there is not. That causes some local swelling and lymphedema. That's normal. There's extracellular toxin accumulation because cells are living. They give off the normal waste products that they do. Plus, you have the products from the injury. And then this triggers inflammatory cytokines, and you have the pain. Now, normally, the body comes in and cleans this mess up. You have white cells and macrophages that clean all this up, and the swelling goes down, and the toxins leave the area, the inflammatory cytokines go down, and the pain gradually goes away. This just doesn't happen in CRPS. Well, let's sort of look at this from what the setup is, low glutathione and poor mitochondrial function. You can measure this in the laboratory. You can measure the genetic things that would set you up for this. We like the 23andMe test. Then comes along an injury, and you get the lymphedema. And because you have poor mitochondrial function and low glutathione, you have an inability to clear out some of these toxins. So things accumulate. You get inflammatory cytokines. There's pain. There's poor autonomic response, and you get reduced toxin clearance. And then you get this cycle of pain. How do we get rid of this? Well, this, in a nutshell, is our process. If you go across the top, that's what we're doing. And then going down are the steps to each step. The first thing we do is improve lymphatic function. And we found homeopathics work best. We use LymphStim or a product called Fatigue by Heal. And then we use proteolytic enzymes, which break up the proteins and whatever mess is in there. They come in there and just eat that up and break it down. What can happen is, if you leave a tube of toothpaste in your drawer for a month with the lid off and you come and try to squeeze some of that toothpaste out, it's all thick and it just doesn't move. Well, that's sort of what's happening when you have lymphedema. Those fluids are not moving, and they may not even be fluids, but more like gels now. And so proteolytic enzymes go in there and just chew that up. And of course, you have to have lots of water along with this process. And then there are some machines that improve lymphatic flow as well. One's a PEMF machine, and the other is a light machine designed to put in a positive charge. And when you charge things positively, they will push away from themselves. The next step is to improve cellular energy, because without energy, none of these processes work very well. And mitochondria are what makes energy in your body. And we've tested a whole bunch of different products, and none of them have worked very well, with one exception. That product's ATP fuel. We have had tremendous luck with that. And so that's the product we recommend for supporting the mitochondria. Mitochondria also need a lot of CoQ10, and we recommend adding that. There is some in the ATP fuel, but we like to add a bit more. And then mineral and vitamin support, and especially vitamin D. If people are not on vitamin D, they're always deficient. I've quit measuring it because I've never found a single person that had normal vitamin D. And we want pretty high levels of vitamin D, 60 to 80 nanograms per deciliter in the blood. And that takes a dose of about 5,000 to 10,000 a day to achieve that level, depending on your weight, of course. But the easiest way to take it is just take it weekly in a really high dose pill. It's a lot cheaper. The biggest source of inflammation in our bodies is usually our gut. So we try to eliminate the inflammatory foods, and we treat the biofilms. Biofilms are just overgrowths of bacteria. These can be toxic and be inflammatory. They can cause a lot of problems throughout the body. And then once we've done that, we want to feed that bowel with glutamine, butyrate, and probiotics, and keep it working well. Now you see this line here between these and detoxification. If you go to, say, somebody that understands this lymphedema, and they say, well, we just need to detoxify you. So they give you some things that increase detoxification in the cells. Well, the way it works is the cells just throw the toxins outside, and they wait for the lymphatic flow to carry them away. Well, if the lymphatic system is not working, that doesn't happen. So you do not want to try to detoxify anybody with CRPS until you've corrected these two areas. So only after the drainage is working, and we want to increase glutathione levels, and we do that very slowly. And we use a binding agent called pectisol. It also binds a protein called galactin-3, which is pro-inflammatory and found in multiple chronic diseases and increases fibrin formation. Well, we don't want any more fibrin. We already have a sticky situation. So these are the key supplements that we use. ATP fuel for the mitochondrial stress. Homeopathics, we use LymphStim or Body Renew. Proteolytic enzymes, we use Enzyme Defense or Zymessence. We've tested, again, a number of different proteolytic enzymes, and we found these two are the ones that work best. We add about 100 milligrams of CoQ10, and you want to use the quality CoQ10. The cheap stuff doesn't work. It doesn't absorb. And then for a binding agent or detoxifier, we use Pectisol C. We like this product because it does not cause a lot of detox side effects, and it blocks the galactin-3. For the gut, we're just doing sort of a general treatment to reduce the load in the gut. Intestinol is one of several products that can reduce intestinal bacterial load. There's lots of others. There's nothing super special about this one, but it seems to be intermediate strength, and it doesn't seem to cause too fast of a die-off or too little of a die-off. So sort of right in the middle. Intestinal repair complex is a compound that contains the glutamine, which we like for healing up the small bowel and giving it some energy. And orthobiotic is a dual function probiotic. It has Saccharomyces in it, which will help keep your yeast and candida levels down, as well as the regular probiotics for your small bowel. And butyrate is an amino acid combination that supplies energy for the colon and also for several key functions of the body, and patients do well on butyrate. What are the lymphatic therapy equipment? We like the PEMF. It's a pulsed electromagnetic force. LymphStim And a rebounder is normally what we use, but we can't use it in CRPS patients because it just can't even touch their skin. So rebounder is sort of out of the question. But after they're well, then this is a way to keep the lymphatics flowing. Basically movement. So this is the action lymphatics made by ELF Labs. We acquired one, actually was just given to us. And we've tested this machine on several patients. I've also tested it myself. I can tell you it really works well. I had some lymph congestion in my eye, and I could actually feel the lymphatic fluid moving down my face to the thoracic duct, which is located at the base of your neck. This machine works quite well. It is a bit expensive, though. PEMF Technology was researched by NASA because they were having problems with bone loss in their astronauts, so they found that magnetic fields were needed, so they developed this type of therapy. It's a passive therapy. It improves circulation, it's effective for pain, and it helps keep the tissue from clumping. Now, the professional units cost $11,000 to $20,000. This is one similar to what we have. And then there's a personal model. So this is a very simple machine. You can lay on a pad, or you can put a coil over the area, or you can wrap it around a member. You turn it on, you push that starts a 3-minute cycle, and you turn up the power. Now, when you first turn it on, you won't feel anything. If you turn it all the way full, it can be extremely painful, and your limbs are jumping up and down off the table. So you just adjust it until you start to feel an effect, but not so much as you feel pain. And I've found there's also a personal model that's more reasonably priced at $2,800. It also seems to be effective. You can check it out on their website. I have no personal experience with this machine, but you can look at what they have to say. So the key factors to success are: correct the lymphedema. Do not detoxify if you have lymphedema. You have to do this step by step. And even though you're improving, you may find there's pain flares. That doesn't mean it's all coming back. It's probably you're doing something too fast. And you usually just step back, work on the lymphedema and the drainage, keep yourself alkaline, lots of veggies in your diet. You can measure your urine pH. It should be between about 6.5 and 7 first thing in the morning. And I'm going to bet it's not going to be there. Okay, this is the usual disclaimers. This is a relatively rare disorder, so while I've seen a number of patients, I haven't seen hundreds. So my experience with CRPS is limited, but successful. This protocol will probably not work for everyone, and this information is based on my experience. Underlying conditions may complicate or limit response. And of course, before considering any therapy, you should discuss it with your own healthcare provider. And here are some of the resources. You can find a written version of this protocol at protocolsforhealth.com/CRPS. And we'll have some links so you can find the supplements. We have supplements on our nutritional store. And then Healthline, you'll have to send us an email or something so you can get on this. But this will give you access to over 9,000 professional grade supplements, which you can set up to be sent to you on a monthly basis if you so wish, and they'll be sent directly to your home. And PEMF, the machine that we discussed, the personal model, that's pulseharmonics.com. So that concludes our presentation. I hope it's helpful. I'm sure if you try it, it will be helpful for some people. Thank you very much.